Although the HIV diagnoses have stabilized over the last years in the United States, what we see is that there's still particular groups who are impacted disproportionately by HIV diagnoses. There are so many types of disparities beyond racial and ethnic. We see also geographic disparities, with more than half of the HIV diagnoses happening in the South, in the southern states of the United States. We also see disparities in terms of women and men, in particular gay and bisexual men, who have a burden of HIV diagnoses, and socioeconomic disparities as well. There are what we call the social factors, the contextual factors that impact people's ability to make healthy decisions, people's ability to seek healthcare services, including prevention services. And in particular, it hits certain areas harder: employment, lack of education, difficulty in accessing healthcare services, lack of health insurance, lack of quality healthcare services, transportation issues. This is what we refer to as the Social Determinants of Health framework. And it's important to understand this if we're truly wanting to eradicate the epidemic. What we see in particular in the southern states are women, for example, and we're looking at the intersectionality between gender and socioeconomic status and race. So women of color in particular who have less access to education are more likely to be vulnerable to HIV, which makes sense because they then are at higher risk. Their ability to get access to services, to make healthy decisions, and have healthy behaviors in their life is less than people who have the ability to have access to these services and resources. If we see that health is actually beyond the biomedical, beyond the physical, emotional, psychological health of individuals, beyond the absence of disease, what we realize is that we have to think about other policies such as housing policy, transportation policy, employment policy. All of these policies are health policies. Health really is about prevention and well-being. It isn't simply the absence of disease. And so if people have the ability to access quality health care, have the ability to get educated, have the ability to have convenient transportation, have housing options, affordable housing, all these social determinants of health will impact the health of individuals, families, and communities.